Our team is composed of three biomedical engineering students at Wichita State University: Mariah Mendoza, Tyler Loddick, and Blaze Miller. We conducted ethnographic research at Wesley Medical Center to find a need. These strategies included full immersion into clinical sites, gathering observations through watching and listening, and conducting a series of interviews. We primarily worked with Dr. Ballman, a physician in the Wesley Family Medical Clinic. While interviewing residents in the pediatric center, we came across a critical need. The residents shared with us a concern for misplacement in nasogastric tubes in children. This interview, coupled with extensive research, brought us to our need statement. A way to address the issue of verifying the placement of nasogastric tubes. This would lead to an increase in safety and accuracy during the initial placement and throughout the course of treatment. It would also eliminate the use of potentially harmful treatments such as radiation that could affect the patient later on in life. In the U.S., there are roughly 1.2 million nasogastric tubes placed annually. However, the rate is unknown in children. All patients in need of nasogastric intubation require verification of tube placement. While conducting research on the problem, it was found that the methods of verification used today are only 80 to 85% accurate. People that are neurologically impaired or ill are especially vulnerable to displacement, as their gag reflex is not as strong. Currently, abdominal radiograph or X-ray is the gold standard used for placement verification in nasogastric tubes. However, other methods of verification exist, including ultrasound, capnography, and use of electromagnets. After looking over existing solutions, our team has come up with two concepts to combat the issues and limitations that come with placement verification. The first design concept is an electromagnet tracing device. The device would be located at the circumference of the tube ending. An external receiver, monitor, and software system would track and verify the electromagnetic position within a coordinate system in the body. The device would automatically turn off and on at set intervals or on demand to regularly check the location while reducing energy use and heat protection. And finally, an alarm system would notify the attendant if the position had changed from the program location. This device is modeled similarly to that of the CoreTrack system. Improvements include the development of making the device used for continuous placement verification rather than just initial placement. Limitations currently restrict the use of electromagnetic tracers in tubes small enough for children. Our device, however, would combat the issue with a cylindrical, hollowed design. In addition to the first concept, we have developed a device that would possibly work in tandem with it, increasing accuracy. The second concept the second concept is a pH reader at the end of the nasogastric tube. The pH in the stomach has a pH that is very distinguishable from the rest of the body. It will wirelessly transmit pH data from the tube to a separate monitor of the device. It will have the ability to transmit live and instantaneous readings to ensure accurate and effective data. This would eliminate any electrical wires and cords that would be necessary from a conventional system that uses circuitry to obtain pH readings. This concludes our video presentation over the verification and placement for nasogastric tubes.